You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures, that nobody should be wearing a loose-fitting denture. He is an expert on the topic. He is a periodontist, Dr. Goel. Dr. Goel, welcome to the program.
Thank you very much, Randy.
All right, now before we get into today's topic, for people that don't know you or your practices, I guess you have 5 practices spread out all over the place where you are. So who's the typical patient? What are the different procedures that you offer?
We see all sorts of different patients in our practice. We may see patients in their teens for wisdom teeth, or we may see patients in their 70s or 80s for other procedures, laser gum surgery, or the pull-down technique or pinhole technique to cover recession, receding gums. But we also see patients for dental implants, and it might be 1 implant or it might be 3 or 4 teeth that they're missing. But the most exciting is when patients come in and they have a denture, and we can really change the quality of their life with dental implants and eliminating their denture from their lives.
You don't like dentures, do you?
Randy, I'm definitely not a big fan of dentures. They're not attached to anything. They just kind of float around. They can rub on the gums and create sore spots. They're hard to chew. You know, a friend of mine always says, your stomach doesn't have teeth.
Okay.
But when you're grinding food with 2 pieces of plastic in your mouth, you're not doing a very good job to extract nutrition and you know all the good things in food, or being able to eat a lot of fiber or fresh vegetables. Well, our body needs those things. And so dentures aren't exactly the way that I want to see people have to live their lives.
So this is the hottest, newest trend in dentistry, is for denture wearers to attach them or lock in your denture on the dental implants?
Absolutely.
Is that the future?
Well, I do believe it is the future, because you can imagine just in the Rochester area alone, there's tens of thousands of people that wear dentures. And around
Really?
Absolutely. And across the country, there's 60, 70 million people that have no teeth. So there's a lot of people out there that may not be aware that dental implants can help change their lives.
If it's so good, why aren't they, what's your take on why are they not all coming in to do it?
Well, that's really easy, because if you may not know the options. So patients that have dentures may not be visiting the dentist unless they have a sore spot. So when they go to the dentist, they're just there to get that sore spot taken care of, and they may not be given the options. Or at one point they may have been told, you don't have enough bone to do dental implants to help stabilize your denture and eliminate the sore spots and discomfort and increase your chewing. So technology.
But isn't it true though, if you've been wearing a denture like 30 years, you don't have enough bone?
No. However, you may have lost some bone. It doesn't mean that you don't have enough bone. You have to remember, technology has really changed how implants can be used for people today. Let me give you an example.
Okay.
Today we have implants that might be a little bit smaller than the ones we had historically. Other implants may be a little bit shorter. You have to remember that today we have many different technologies that help us use the bone that you may have. So yes, you may have lost some bone, but it doesn't mean you don't have enough bone. And so we have 3D technology that helps us show how much bone there is in the jaw and where to go to use it for implants. We have shorter implants. We have slightly narrower implants. So we have a lot of choices. We also know that as little as 2 implants will help a denture snap in and out and really, really change the quality of someone's life. I just had a patient, maybe 2-3 weeks ago, we wrapped up, and it was amazing because he'd had a denture 40 or 50 years, Randy. He did not have a lot of bone, and he came in and he was really worried. He didn't think he had enough bone. His dentist didn't think he had enough bone. His wife didn't think he had enough bone.
Really?
And so, you know, we did a scan. Sure enough, there was some bone there we could work with. We got a couple of implants in, and now he's back with his dentist, getting wrapped up to have, really, when you think about this, being able to chew and function for the first time in 40 years. And that's what, to me, practice is all about.
So these lock in?
They lock in, they snap in and out. It's unbelievable what a difference just even 2 implants can. We can always do more, but it's just amazing what a difference 2 implants can make. Back to your original question, Randy, about why aren't more people doing this? Well, first of all, people who have dentures don't necessarily know that this is an option.
Okay.
You also have to remember that people who have dentures, they may have gone to the dentist 30, 40, 50 times over the years. They're not going to want to go back again. And the time when they
do you hear that, by the way? No offense, doctor, but I don't.
I've lived at the dentist, and this is what it got me, dentures. I hear it all the time. So to them, dentistry really hasn't helped them. So why would you go back? On top of that, when you do go back, it's because you have a sore spot or the denture's digging in somewhere. And so it becomes a little bit of a negative experience when they come in and to have that sore spot.
What about pain, though? Because it does seem painful. Are they afraid of pain?
No, discomfort shouldn't keep you from doing this. It's incredible how few patients have discomfort after a procedure, and if they do, we can always prescribe medication, or they may take an Advil. But most patients, what I've found over the last 10 years in Rochester, is that they don't have discomfort after the procedure. And they'll go home and they'll go ahead and they'll eat, and we always have to tell them, well, slow down, take it easy. You know, I had a surgical procedure here. Or patients who have sedation, they don't know what happens during the procedure. And then when they get home, sometimes they won't even know they have their procedure done. We might get a call the next day and they'll say, hey, you guys didn't do anything yesterday.
Come on.
No, I'm serious.
They've
that actually
said
happens.
that.
Yes. So it's really fantastic how comfortable these procedures can be. And a lot of it has to do with the technology. We have, like I said, we have less invasive procedures now. We have technology to know where the bone is. We just don't have to be as invasive as we were 10 or 15 years ago.
Now, you say things like they can walk in on the day of the procedure with no teeth, and they can walk out with teeth that are either fixed, that don't come in and out, or snap in, snap out, same day.
Yeah, absolutely. It all depends on what the patient wants to accomplish that day. But if a patient wants to have teeth that are fixed in place that day, at the day of their procedure, we can do that. And what we try and do is we really spend a lot of time with patients to figure out what do they want to do, what do they want to accomplish, what fits with their lifestyle and fits within their budget. We don't want this to be uncomfortable, but we also don't want it to be financially uncomfortable for patients. We want to give people options. There's so many different options. So we want to spend the time working with patients to find something that's comfortable for them financially, but also we want to assure them that they're not going to be uncomfortable during or after the procedure for most cases.
How old can you be to get this done?
We see patients in their 70s, their 80s. I have a friend who treated someone who was 102.
Really?
102.
Okay.
So I have a funny story. I had a patient, she was 82 at the time, and it was very traumatic for her. Her lower teeth were not working out. We had to remove them, and she really didn't want to go without something that was fixed in place. So what we did for her is she came in, we got her numb, we removed the teeth, and we put in 5 implants, and eventually she had a locked-in whole arch of teeth fixed in place. She had the most incredible smile. But what stuck with me is when we finished her procedure, she got out of the chair, she looked right at me and she said, "That's all you got, Doc?" And
what does she mean by that?
It was a piece of cake.
That means it didn't hurt or whatever?
No, and it was just amazing how comfortable these dental implant procedures can be.
So you should not let the fear, because obviously these are, seems like a painful procedure, but they're not left without teeth, right?
No. Again, there's many different options for patients. We can have teeth that are fixed in place the day of the procedure, or we can have some temporary dentures that are made during the healing phase, or if the patient has their original dentures. But we can do whatever a patient feels comfortable with and fits within their budget.
Now, you say things like you transform people's lives.
Yes.
You believe that?
I see it. I see it every day in my practice, how taking people away from dentures that aren't attached to anything and simply rub against tissue. Imagine a piece of plastic just rubbing against tissue. How comfortable? You wouldn't want that in your mouth. Mm-hmm. You don't want to be known as the grandparent who didn't smile or couldn't have a meal with the family. That's not how you want to. You're
a periodontist, right? Mm-hmm. So you probably think that the smile is one of the most important things. How important is it as you see it?
Well, it's not one of the most important things. It's the most important thing. A smile goes wherever you go. It's something that you have with you, but it's something that is also who you are. So when you have a smile, think about this, a smile can ignite a romance.
Okay.
Yeah. A smile can open doors for you in a job interview. A smile is so important, and it's something that I think that people who don't have a smile, I think they really miss it, and they may not even know they miss it. And my patients tell me that it's important. When they come back and they have their teeth, they tell me how their lives have changed and how people treat them differently now. And I have one patient, young fellow in his 30s, and he lost all his teeth, and so we gave him some dental implants and a new smile. And boy, I'll tell you, he does not stop smiling. It's ear to ear. And I asked him, I said, "Do you ever stop smiling?" And he said, "Well, why would I?" His life has changed because of his smile.
Moving on to dentures for a moment. So what are their options? On a consult, by the way, so what is discussed as far as options?
We can start with something as simple as 2 implants and a snap-in, snap-out denture. And it's amazing with a snap-in, snap-out denture how much that denture can stay in place.
No more adhesive with that?
No more adhesive, no more powder. Let me tell you about the life of a denture wearer. You wake up in the morning, you may not know where it is. It might have come out during the night.
Okay. Has that happened?
It happens. I hear the stories from my patients that, or they may have lost their denture, and that's why they're in. And so first they have to hide from their spouse that they're cleaning it off wherever they found it. And then they have to put some powder in it to have it stay a little bit in. And then they'll go to work. When they go out, when their coworkers go for lunch, they may not be able to enjoy the same kind of lunch because, again, you don't have something that's fixed in place. It's something that's moving, and so depending on what the food item is, a lot of your food items or food choices are limited now.
Now, I know a few denture wearers.
Mm-hmm.
They never complain about their denture.
Well, you're not a dentist, so why would they complain to you?
Okay, good point.
So,
but so is your thought that there's really no such thing as a happy denture wearer, or they've just adapted? What are your thoughts?
Well, it's relative. They've adapted. You know, you lose your teeth, you get your dentures. After a week or two, you're going to adapt. It doesn't necessarily mean you're happy there, but it's what you have. And the same is true when we put implants in and we attach those dentures to those implants. Almost immediately, patients adapt, but now they have so many more options. Now they can eat what they want, they're chewing things effectively, they didn't have to go through a lot of discomfort to get the process completed. So it's really amazing how much it changes your options in your life.
Well, let me see that for a second. Okay, so this is an implant model.
Yes.
2 implants here.
Yes.
And then just snaps in. Could you use their existing denture?
Sometimes.
Because I don't know if the camera can see this, but there's little snaps under here.
And snap it in. Listen to how firm that snap is.
Okay.
Okay, so when it's on there, it's
on there. Could it ever
get
too snug?
Well, it's actually, believe it or not, even with 2 implants, it can actually be so snug that for some patients it's difficult. So we actually can adjust that.
You love a snap in, snap out. You told me that on the phone. I'm not even paraphrasing.
Yes.
Why do you like it so much?
I love them because they're very comfortable for patients to not only wear, but go through the process to complete. They're very, very cost effective for patients. And if anything occurs with any of the implants, if a repair needs to be done on the denture, any of those things can be done very, very simply and very, very quickly. So it's a very nice, safe approach to getting something that's very, very functional and aesthetically looks fantastic. You know what I'd love to do is have every denture wearer near my practice, and there's got to be 20, 30,000 denture wearers in the greater Rochester area. I'd love for just 10 seconds for them to be able to test drive dental implants with their dentures and see.
It can't be done though, right?
Can't be done, but wouldn't it be amazing if they could experience the difference in not having those plastic items or those plastic dentures rubbing against the gums and creating sore spots?
They couldn't go back if they tried them out?
Could you? Could you imagine taking your teeth and having your teeth not fixed in place? You wouldn't want to do that. If you had an opportunity to have that again, you would never give that up.
2 implants, snap in, snap out. What's the next level up?
Well, from 2 implants, we can go to 4 implants. 4 implants is really fantastic. It's like a table, okay, with 4 legs. And so you have a lot of stability. Now you're not putting pressure on the bone anymore, so you're going to preserve that bone a little bit more. And you don't have any movement at all, so there's no sore spots that'll develop over time. So 4 implants is fantastic. I just thought of a patient that we did this for very recently, and it was incredible because they loved to eat a certain food, and that was pecan pie. Now the thing with, and I love pecan pie too, and so the thing with pecan pie is if your denture is moving at all, and with 2 implants you can get a little bit of a fulcrum.
Oh, because it's sticky.
Because it's sticky,
is that right? Okay.
And so it's going to move a little bit. But with 4 implants, you can go ahead and you can crush those pecans up, no problem, and you're going to really enjoy that a little bit more because there's not going to be any movement to the denture at all. So 4 implants is a great option. Other things they can eat are salads, corn on the cob, biting into an apple. A lot of different choices when you start getting into the 4 implants.
Are there like tipping points or triggers where they finally say, I've had enough, and they come in to do this?
There are. It might be a patient I had recently. He was golfing with his friends. Great golfer. Well, he bent down to pick up a ball. His denture fell out. His game didn't go very well for the rest of the game.
His buddies probably laughed.
They were not kind. And so after that, he came in, and I heard his golf games gotten tremendously better. So,
is this one of those things where people say, I should have done this years ago?
Absolutely. But they may have been told they didn't have enough bone, or they didn't know it was an option. So people can't beat themselves up for not having it done earlier. I'm just glad that they're coming in and that we're being able to help them now.
You work with general dentists then. They refer you patients most of the time?
Yes, we're very fortunate. We work with a number of general dentists in the Rochester area for patients that may have one missing tooth or several missing teeth or all of their teeth or have dentures and they want to get implants to stabilize those dentures. Back to options for denture wearers. We talked about 2 implants. We talked about 4 implants with the snap in, snap out. There's an option with 4 implants with a fixed type option, with a fixed prosthesis. It does not come in and out. And that's what people want, teeth that don't come in and out. Another option is 4 to 6 implants with a full arch of teeth. It's one piece. It's looks great. It's strong. You can eat what you want, but it's a little bit difficult to clean. Okay. You have to work underneath it to get access to it to keep things healthy. My favorite is a couple more implants, about 8 implants, but it's porcelain crowns and bridges, just like your natural teeth.
You had a model over there in the green room. With this. So This is like having teeth. Again.
It's just like having teeth. You're going to floss and brush them normally, and the smile is just tremendous. It's porcelain as opposed to
so it looks like real teeth?
Looks like real teeth. You can bite into a carrot on your 2 front teeth or an empire apple right off the tree. And it's the most natural option. Patients don't have to think about their teeth anymore. It's just like when you go out to dinner. You don't have to think about your teeth.
I don't.
You have your,
That's right.
Right, and you have a tremendous smile, and you can enjoy life to its fullest. It's the most natural option. It's the most like what we had to begin with, and I think that's important.
How long can they last?
Implants, I always tell patients, they're probably going to last as long as you need them to last.
So they can last forever.
They can last forever. Sometimes they may need a little bit of attention here or there, and we have the technology to do that if it's necessary, and that's important. That's something that's important to ask.
So it's like permanent teeth.
It virtually could be.
So on the consult, what are the frequently asked questions? Like, what do they want to know?
Patients will primarily be interested in, is this going to be uncomfortable or not? And we go through that and we talked about that. And by and large, dental implant procedures are very, very comfortable today.
Okay.
They're concerned about the expense, but we have a lot of financing options available to make it affordable for patients. And then they want to know what is right for them. And really it boils down to what is going to meet their expectations and
Okay.
what they want, and whether it's removable or fixed. And I always just tell patients, this is your chance. This is your 3rd set of teeth, and you had your 2nd set. They didn't work out, but now you have a chance to go back, and we're just going to make that 3rd set whatever you want, whether they snap in and snap out or whether they're fixed in place. We're going to do that for you. We're going to find a way to make it happen.
Insurance does not cover dental implants. Is that right?
That's true.
Or Medicare, Medicaid. So what do you do?
That's true. But this is a big but. But we have lots of ways to make the process affordable for patients. We want patients to be able to live their lives fully and to leave their dentures behind. And so
we have financing.
We have financing that we work very, very hard to find a way for patients to move forward.
Now, what about the people that have bad gums, right? And they know they are losing their teeth. Can they get dental implants? Or can the gums be too bad?
Having periodontal disease or gum disease doesn't mean you can't have dental implants. It just means that before we put your dental implants in, we clean up your gums. We have a laser that goes through and can clean up that bacterial infection which is causing the gum disease and causing the redness and the bleeding and so on. So we can clean all that up, and that day we may put the implants in, or we may wait, depending on what the patient wants to accomplish. But absolutely, having bleeding gums or periodontal disease does not in any way mean you cannot have dental implants.
I guess the main thing here is, I guess you could never be too old, right? You say your friend did a 100-year-old with dental implants. Why would a 100-year-old want to do this?
Because they want to eat and chew. Imagine, you're retired. What do you do all day with your friends? You sit around, you eat, people bring you food.
Yeah, okay.
So at what point do you say, I don't want to enjoy food anymore? So I think no matter what your age, keep on living, keep on enjoying food, keep on enjoying the foods you want to eat on your terms. Just because you may have lost teeth and you have a denture, or because you're losing teeth to gum disease or decay, doesn't mean that you want to stop enjoying the things that you're enjoying. You want to keep living the life that you're living, or maybe improve it a little bit if you are wearing dentures currently.
So does somebody need, you're a specialist, does somebody need a referral to see you? I mean, if they want a consultation, they can go to you directly.
Yes, absolutely. They can call our office and schedule an appointment to see me. It's a complimentary consultation. Sometimes patients do hold on to their teeth too long, and I'd rather have someone come in and see me and talk about their options before they get into a process where the teeth are causing a lot of infection or a lot of pain to them. I'd like to start the process earlier when we have more bone and things are a little bit easier to work with than later on in the process.
Who is it? More men, more women that are doing this?
I would say it's equal. Unfortunately, decay doesn't discriminate, or periodontal disease doesn't discriminate. Everybody is susceptible to those problems.
Do men put it off longer because they're stubborn? They wait until they can't eat, literally? By any chance?
I think everybody is equally stubborn. So,
okay.
But no, we do like patients when things are starting to get in trouble and fall apart a little bit. Just call, come on in. We'll go through the different options. It's not a difficult process. It's not an uncomfortable process. It's an affordable process. And quite frankly, when patients are done, I have thousands of patients in Rochester, and it's amazing. Everywhere I go, I run into patients. It might be at the zoo,
is that right?
Or at the grocery store. I mean, we just have it's wonderful, and we're very, very thankful for all the support Rochester has given us. But the amazing thing I hear again and again and again from patients is, it really wasn't that bad of a process. And a lot of it is the unknown. If you haven't gone through it or a loved one hasn't gone through it, you really don't know what the process is. So it's a little bit of the unknown, but that's what we're there for. We work through it together, and we're always there for you. So we're able to, I'm very happy to be able to say we have thousands and thousands of happy patients.
Where are your practices? Because you have, what, 5 practices right now?
We have 7 practices in the Rochester area, as far south as Geneseo, as far west as Greece, and as far east as Webster.
So does everybody have this philosophy? I mean, everybody's trained up to speed. They all don't have to see you, obviously.
Right, absolutely. All of our doctors are extremely competent, extremely caring, and they all share the same values that I have, that we want people to have happy, healthy, and comfortable smiles for a lifetime.
This book,
Yes.
The Joy of Smiles. I always hate when interviewers ask, why did you write the book? But why did you write the book? It's a book about, and you like this book.
I love this book.
Okay? Because it seemed like a boring book about dental implants, right? But it's not.
No, it's a way for patients to experience what is involved in the implant process, why they should be involved in the implant process. And it has a lot of answers. There's a lot of questions in here that I feel patients should know to ask their doctors. But it also tells a little bit about myself and my practice and our philosophy.
You have fun at your practice. I mean, you're considered a very funny person, right? Humorous.
We have an absolutely amazing fun time at our practice because I don't consider it work anymore. Doing this for patients, I can't consider this work. It's just a ton of fun. My patients are my friends. So basically all I do all day is visit with my friends, make them healthy, make them happy, and help them enjoy life to the fullest.
So this is the happiest group of patients of all? I mean, people that you can give their teeth back, obviously?
Yes. The patients that come in with dentures or no teeth or lose their teeth and go to a full mouth of implants are by far our happiest patients because they were in a position where they were ready to lose everything, they'd already lost everything, and now they have everything back. And so they know what it's like to have to not be able to have dinner with their family or be able to try their granddaughter's cookies she made at school. They know what that pain is like, to not be able to share in all the good things that life has to offer. Because so much of our life centers around food. We see our old friends from college. We go out to eat. We go with coworkers at the end of the day to eat. We learn. When we learn at lunchtime, if a doctor comes in to teach us something or a local representative, we learn around food. Everything we do centers around food.
And there's that many people that can't enjoy that, is what you're saying.
There are millions and millions of people in this country and tens of thousands in the Rochester area that have no teeth.
Do you think dentures, traditional dentures, are just a failure of dentistry? Like, I mean, it's just wrong?
It's what we had. But today we have better options. We just didn't know, we didn't have implants as an option historically. So now with implants as an option, there's no reason to have traditional dentures.
Okay, so this book, if somebody is about to lose their teeth, they know they don't want false teeth, or somebody that's wearing a loose-fitting denture, they could get this book. Where could they get it now?
Well, Randy, my publisher is going to kill me.
Okay.
But Rochester's been so good to me and my practice over the last 10 years, what I want to do is if your viewers go to joyofsmiles.com and click on the little button there and put their information, I'm going to send them a copy of my book electronically. And if they want a hardcover copy, I'll come on in, come see me, and I'll sign a copy for you myself.
It's not painful, or that, I guess it's, relative, but pain is not something they really complain about. And you'll manage their pain afterwards.
Right.
Right? They just get a little swelling or things like that.
Patients after surgery can have some swelling. Discomfort tends to be very, very minor, if any. And we have medication that can manage that. So really, what patients complain about the most is that they hadn't done it sooner.
And this is computerized in your hands.
Yes.
What does that mean, computerized? What does that mean?
Well, it can mean a couple of different things, but one is we now have the ability to take three-dimensional images of the jaws and bone. We have the ability to know exactly where the bone is before the surgery. So now the surgery is less traumatic, less invasive, and in many cases doesn't even require a stitch. And in our practice, we have 5 cone beam scanners, more than anybody else in the Rochester area. So our patients can easily access the technology.
Would you say that because I know you're one of the busiest practices in Rochester, would you say you're the premier center when it comes to dental implant dentistry?
Our goal is to be known as the place to go for dental implants in the Rochester area. We want to serve our patients to the best of our abilities and have as many happy, smiling patients as possible.
Options. So you have the 2, just as a recap. So if you're wearing dentures, 2 implants, snap in, snap out, 4 implants, snap in, snap out, or 4 implants fixed, or 6 or 8 with porcelain teeth. I feel like I could spot a denture walking down the street. Is there a cosmetic component to this? Do they look real?
Well, they do look real because they're fixed in place. Even with the snap-in, snap-outs, they're not moving. So you ever heard a denture wearer when they're talking? You ever hear that clack, clack, clack as the...
Little bit.
So you're not going to have that anymore because the dentures are fixed to the jaws. And with the full porcelain, that smile just looks so natural, you wouldn't know whether someone had the porcelain teeth or their natural teeth.
So they should get your book, The Joy of Smiles. You're giving a freebie away.
I am.
If they call your office. And final message, somebody watching this, they're still afraid of the dentist. What do you say to them?
Come in, we'll talk. We don't even need to look in your mouth. We can talk about ideas and I'll answer any questions you may have. It's a complimentary visit. And once you do it, you're just going to be so happy you took that first step.
Okay, good. Thanks for coming to the show. Very good. Very interesting. Thanks.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.